those in favor say aye.
Aye.
Aye. Opposed, nay. Ayes have it, the motion carries. And Senator Guida?
Yeah.
Yeah, the vote was 5-0. Senator Guida will take it out. Senate Bill 268.
Move out to pass.
Second.
Senator Guida moves Senate Bill 268 ought to pass, seconded by Senator Reagan. Discussion? There being none, all those in favor say aye.
Aye.
Aye. Opposed, nay. Ayes have it, the motion carries 5-0. And Senator Reagan? Senate Bill 366, requiring an audit of ballots cast in the 2022 primary and general election.
Move out to pass.
Senator Guida moves ought to pass, seconded by Senator Hennessy. Discussion? There being none, all those in favor of the motion say aye.
Aye.
Aye. Opposed, nay. Ayes have it, the motion carries 5-0. And I'll take that one out.
Move reconsideration, so we can put them on consent.
We can't put them on consent.
Oh, finance, that's right.
Okay, Senate Bill 396, relative to solid waste management.
I would move on.
Senator Rosenwell moves ought to pass, seconded by Senator Hennessy. Is anyone here from the department? Okay. One of the issues that I had in going through this is that the bill as it's written allows the department, it says the department may contract with a hydrogeologist for a particular project. But if that project is a municipal project, then the department requiring a hydrogeologist becomes an unfunded mandate. So I wondered if, would there be any objections from members of the committee if we brought in a committee amendment to exempt political subdivisions?
I guess I'd want to ask that prime sponsor. I don't know this subject area well enough. I don't know what percentage of the projects are municipal. I think Nashua's the only municipality that has its own landfill still. Littleton or so.
There's one in Success that has a bunch of municipalities. So it's.
Well, I think you're back from Littleton spoke, didn't you? Who's the person that gave it spoke to us? That lives over this thing. It wasn't Littleton?
Dalton?
It was on another bill, right?
Yeah, right. So, but he specifically came and said that he managed Lebanon.
Oh,
Lebanon.
That's right.
He managed to leave.
Okay.
District 5.
I'm going to remind my members, if they're going to talk, you need to have your microphone on or people won't hear you at home.
Right, right. Thank you, Liz. I thought that it wasn't on this piece of legislation, but an individual came from Lebanon and talked about how he managed the landfill. So I don't know if this would impede the management of that landfill.
Senator Gaida?
Thank you, Mr. Chairman. I sit on Energy and Natural Resources. This bill would require any entity that's considering or putting in an application to site a landfill, okay, to perform a hydrogeological survey to determine whether or not leachate would go 5 miles, underground. And so it was obviously supported by the committee in the interest of protecting parks and private property and so forth. So in the event that a political subdivision, a town or county were to open a landfill or request to site a landfill, then they would then have to perform this hydrogeological survey on their own. If the department found that that survey was not adequate, then they could require the applicant to perform or to contract with someone, a hydrogeologist to perform another or an amplified or supplemental survey. So that's, again, the political subdivision piece. I guess I wouldn't have a problem with that amendment. I don't know, other than perhaps, are we asking the state to pay for a municipality's costs since they're the applicant? And that's a question that we probably need to discuss.
Senator D'Alessandro?
Oh, thank you. In reading the amendment, and I think this is the final situation, this is the final bill, the amendment that I'm looking at, the bill as amended. It says the department may enter into to a written agreement, so there is some latitude there. It may enter into a written agreement with the applicant for the department to retain, at the applicant's expense, an independent licensed professional engineer or hydrologist to assist in making that information. I think there's enough flexibility there for the entity.
The fact that it's flexible.
Yes.
It is good, but it's also problematic because if the applicant is a municipality and the department decides that they're going to require somebody, that's when it becomes a cost on the municipality.
Sure, I think that's true, but I think the initial language is flexible enough with the term may. It doesn't say shall enter into a written agreement. It says it may enter into a written agreement, which allows for the latitude to get somebody of their own choosing. I don't know. I think there's enough flexibility there, but I would defer to the chair if you thought something else was needed.
I guess my question is, I'll put it another way, is there anything that prohibits the department from putting an extra cost on a local municipality if the municipality is the applicant?
Well, I mean, there's nothing here that says that, but one would think that the entity would be, I think, flexible enough, knowing what costs are, and knowing that the key element is to get somebody capable to help make a decision. I mean, so I think, as always, that's an open question. But generally speaking, I think the state's pretty good in terms of working with somebody in order to not cause them an extra expense. We've been pretty good at that. Okay. And it seems to me this is consistent with the way we've been operating.
Okay, thank you, Senator Goddard.
Thank you, Mr. Chairman. I think, too, that a municipality seeking to open a landfill would probably, on its own volition, want to know what's going to be the impact of the leachate from that on the surrounding wells, on the community, and any water bodies that might be around. So I understand the 28A issue. But again, if the municipality is actually the applicant, would they not responsibly want to know what the consequences of siting that landfill would be?
Senator Rosenwald.
Thank you. I am in complete agreement with Senator Gaida. Well, I am all the time, often.
Yeah, I wish you could say that about Senator D'Alessandro, but
well-
you see how far in the dark I am at this point in time.
But if I could also
Pass
say,
right
my
over.
understanding is that the amendment that the Senate did in the Energy Committee was to go from shall to may at the department's request, to give them the flexibility to not have to levy that cost if they didn't think it was necessary.
Any further discussion? Motion before us is to pass on Senate Bill 396. All those in favor of that motion say aye.
Aye.
Opposed, nay. Ayes have it, motion carries 5-0. And someone like to take that out?
I'll do this.
Senator D'Alessandro? Senate Bill 407, relative to expanding Medicaid to include certain postpartum health care services and make an appropriation thereof. Senator Gaida?
Do we want Mr. Lippman to testify, Mr. Chairman?
Yes.
Do we need to open the bill to do that, or can he just come forward?
Well, we do have some questions, so, Mr. Lippman, if you could maybe answer the questions first, and then we'll take a motion. Thank you.
For the record, Henry Lippman, Medicaid Director.
Thank you. One of the questions we had is, it looks, the way the bill is written, it looks like ARPA funds are being used. But in the absence of ARPA funds, then general funds will be used. In addition, going forward, there'll be a $200,000 to $1 million annual appropriation. Is that all that correct?
Not quite, mostly. So the ARPA is the provision that increases what the federal government will contribute towards Medicaid if we go from 60 days to 1 year. So that's just a sort of a enabling legislation. The 200,000 to $1 million is an estimate range based on the fact that the amount or percentage of federal match that we would draw would depend on who delivered the babies. Was it someone in Granted Advantage where we get a 90% match, or is it someone in Standard Medicaid or a different eligibility group? I think 200,000 and 1 million represent the far end of the ranges. I think it'll probably end up somewhere in the middle, but we would just wanted to be clear that there's a range of estimates because we don't know who's going to deliver in a given year. And that's the general fund impact, including what would be required from Granted Advantage, which is not general funds, would be from the trust.
Okay, and what happens when the ARPA funds run out?
So ARPA funds aren't being used here at all. ARPA is the enabling statute that says the federal government will pay more than they did before. So there's no ARPA funds at all in this.
Senator Rosenwald.
Thank you. I thought I was following this until you confirmed that we don't use general funds for the Medicaid expansion.
Correct.
So why would the department not be able to kind of project how many traditional Medicaid women might lose their coverage between that 138% and 196%? We must have caseload data. Historically, what is it, a couple hundred births per year?
No, it's more than that. But let me just explain the range that we developed in concert with our actuary. And $200,000 representative, we were only getting 50% match across the board. The 1 million range represented if we got a historical mix of births, if you will. What I'm saying is whether what's historically existed and, you know, getting everything at 50%, it's hard to predict that, but I'm just trying to, if you will, give you goalposts of what it could look like.
Follow up?
Thank you. But I still don't understand, because the Grant Advantage women don't lose their coverage after 60 days.
So that, when we developed the estimate, it wasn't clear what the federal government was going to do with Granted Advantage. They've subsequently come out and said something to the effect that they'll give us some sort of weighted average formula. And that's, again, why, not knowing what that exact formula is going to be, why I try to give you a range of what it could cost, because it's pretty, while I think it falls in that range, I can't tell you whether it's upper end or lower end of the range, depending on how CMS implements that that formula, if you will.
Could I just ask one more follow-up?
Sure.
Thank you. But couldn't we just say, here's a number of women on traditional Medicaid who have been covered under not Granted Advantage, but the Medicaid program, traditional Medicaid, who have given birth. So it's not children, right?
Right,
Because they're
it's-
kids Medicaid. It's not presumably the long-term care waiver. So it's a defined group of people who have been subject to losing their coverage 60 days postpartum. And we know that we get a 50% match for that. Why can't we get a closer estimate?
Again, not knowing, for example, today, the Granted Advantage population is around 87,000 individuals, right? In terms of how the federal unwind's going to work, and you know, when we're going to get back to 52,000, we think that will happen sometime in the next year range. But again, if you want a different number based on what you're giving me as parameters, I could certainly have that calculated. What we put in the legislation was sort of the low end, if the most favorable situation that we could get, and probably the least favorable based on, but we could certainly give you a different number if you wanted it.
Well,
Yeah.
Thank you. Senator Alessandro.
Okay, thank you, Mr. Chairman. Henry, thank you. Henry, the legislation as introduced calls for a $200,000 appropriation and a continuing appropriation. So explain to me, based on what you just said, what's the 200,000 going to do?
That represents, I think, a situation where things are work pretty optimally. You know, I think in terms of whether it's 200,000 or 300,000 or 400,000,
Right.
the sponsors went on the low end of the range in terms of what they put in the bill. Do I think we can work with however it comes out in between that? I think we can.
Okay. So the number's flexible, is what you're telling me?
Yes.
And the number that's in here now is a placeholder?
If we got $200,000, we could work with that number.
Okay, okay, good. Thank you, Mr. Chairman.
Further questions? I guess I'd like some clarification, because now I'm
Sure.
thoroughly confused.
Okay.
What I just heard from Senator Rosenwald's questioning, in your answers, it sounds like we're not using ARPA funds
Correct.
and we're not using general funds.
We're not using general funds for the Granted Advantage population because we have to use trust funds.
Okay. Yet, so, I'm reading from the bill, the governor shall determine if any discretionary funds appropriated in the American Rescue Plan Act of 2021 Public Law 117-2 or any other federal funds can be used for this purpose. and the commissioner shall expend such federal funds for this purpose. Any remainder shall be appropriated from the general fund.
So that refers, Senator, Mr. Chairman, to the fact that the federal government's going to be paying their share, not just for 60 days, but if we adopt this all the way out to 12 months. That's the new federal money that was in ARPA, if you will, to basically give the federal government additional money to match.
Okay. Senator Hennessy.
Thank you, Mr. Chairman. Thank you for answering our questions. More of a timing of the appropriation and when it's appropriated. So the appropriation is for $200,000 for the fiscal year ending June 30, 2022. But I don't see any lapse information in here. So I don't imagine that if this were to become law, those funds would actually be spent for this current fiscal year. So how does that work?
So I think you point out an issue there. If the funds lapse in 22, we wouldn't have, this would probably go into effect. I think the law, the proposed legislation talks about us applying, I think, in August and getting something in place by September, if I'm remembering, by January 1st, if I'm recalling it correctly.
Further questions? Senator Rosenwald?
More, sorry. Does the department project any potential savings in extending this health insurance coverage?
I think that there are savings to be considered here, but they're more qualitative in terms of, if you look at the reason why, I believe 15 states have adopted this legislatively, and 26 states are in other forms working towards implementation of this provision, is that there's, after 60 days, there's mortality issues that happen in mental health issues that when they go untreated, if a mother's not there to provide care to their newborn child, they come downstream costs. We didn't attempt to quantify those costs. I think if in the literature, there's certainly studies that identify that, children who mothers have developed heart conditions or other postpartum conditions, depression, that there are cost externalities, whether they fall into Medicaid or they fall elsewhere in the state. I think didn't attempt to do that, because I think in terms of the hard dollars that the state would need to put up is what I really try to include in the legislation here. It's somewhat akin to dental, that savings may occur over time. It's hard to know whether they'll occur, in what period of time, but I think good public health perspective suggests that there are women that will definitely benefit from, because they can't get all their medical care needs necessarily addressed in 60 days.
Senator Goddard?
Thank you, Mr. Chairman. Two questions, Henry. So first, what we're establishing here is a permanent general fund expenditure, or does this terminate when the ARPA authorization terminates?
So a good question. The ARPA provides 5 years of this enhanced federal funding. At some point in the future, there could be an additional expense if the federal government doesn't continue it. There has been other legislation where it's proposed to make it permanent, but ARPA only deals with a 5-year period, and that may be related to how they score things federally.
So your earlier statement that ARPA funds are not coming for this.
ARPA funds are not replacing general funds or trust funds. The ARPA funds are to finance, if you will, the federal share component of this benefit.
Okay. So follow-up?
Follow-up.
So how does this coverage that's proposed compare with private sector coverage? Is there equivalency?
Well, I think that in some respects there is. So if, for example, if you're employed, you typically would keep your coverage, you would have continuing coverage in an employment situation, whereas in Medicaid, if you didn't meet the income eligibility at the time, if you went back to work, as an example, you lose your coverage unless you picked up coverage, in the commercial market. So I think it does, if you will, level the playing field over someone who, remains with a commercial plan, who otherwise, purchased it on their own. They would, they usually buy it a year at a time.
Follow-up.
Thank you, Mr. Chairman. So do you know if the private sector coverage goes out 12 months, or is there a standard in the industry?
I think it's typically, as long as you're paying your premiums, you're continued to be covered.
Thank you.
Any further questions? Seeing none. Thank you, Henry.
Thank you. Sorry for any confusion I added here.
Don't go away.
Okay, Senate Bill 407. Do we have a motion on this? Okay, Senator Rosenwald moves on to pass. Is there a second? Second by Senator D'Alessandro. Discussion? Senator Hennessy.
Thank you, Mr. Chair. I think we heard from Mr. Lippman that we need to change the date for the first appropriation. Okay.
Because of the lapse issue, right?
Yep.
Is that the you suggested? Because with this thing, you getting? Good suggestion.
So is it, that be a committee amendment, or?
I would guess if there's no objection, it could be. Okay. So all those in favor of changing the date, say aye.
Aye.
Aye. Opposed, nay. Ayes have it, motion carries. Further discussion. I'm going to be voting against this bill. There's a few things which, some of it I still find somewhat confusing. I understand the comment that ARPA is not replacing general funds, but the fact that ARPA is involved in it, those ARPA funds are gonna run out. And so the question is, what cliff do you come to at that point in time? Secondly, I'm really hesitant about starting to put into a budget a figure that goes anywhere from, is it 200K to $1 million? I mean, it's a widespread. I understand that it can fluctuate, but I don't think right now is the time to expand our Medicaid program. I mean, we have a lot of other things that I think are a higher priority as far as money that we're going to need to commit to. So I will be voting against this. Further discussion? Seeing none, motion before us is ought to pass on Senate Bill 407. All those in favor of that motion say aye.
Aye.
Opposed, nay? Nay. And motion carries 5-1. And okay, Senator Rosenwald. Going on to Senate Bill 408, directing the Department of Health and Human Services to make adjustments to the facility fee reimbursement schedule for freestanding birthing centers.
Move in expedient to legislate.
Senator Gaida moves in expedient to legislate. Is there a second? I will second. Discussion?
Thank you,
Senator Gaida.
Thank you, Mr. Chairman. This is obviously a well-intended bill. However, the level of services that's provided by a birthing center versus a hospital emergency room or an obstetric gynecology lab or clinic are somewhat different. And whenever a problem occurs, the person is then transported to a hospital from one of these birthing centers. So, trying to establish, if you will, parity of some sort for services that are disparate is concerning. Birthing centers are private businesses, and if they have problems meeting their costs, they raise their prices. That, to me, would seem an appropriate way to ensure both the quality and the necessary quantity of these establishments. And for that reason, I'll be, I said, supporting my motion of ITL. Thank you.
Thank you. Senator Rosenwald.
Thank you. I'm not going to vote for the motion of ITL for really only one reason, and that is because hospitals have been closing their obstetrical units, and I think for people who live in the rural parts, and not only the rural parts, I think Parkland just closed their OB unit as well. If hospitals are closing their units because they're losing money and they can't keep the obstetricians employed, I think we have to make sure there is a safe and competent place for women to give birth in New Hampshire. So for that reason only, I'm going to vote against the ITL.
Thank you, Senator D'Alessandro.
Thank you, Mr. Chairman. With reference to what Senator Roosevelt just said, it appears to me that in the testimony, Director Lippman, you said that these birth centers would be in high population areas, but wouldn't be in low population areas. Is that true? Is it, Mr. Chairman?
Yes.
May he address that question?
Yes. The chair recognizes Mr. Lippman.
Thank you for the record again, Henry Lippman, Medicaid Director. Senator, they're located currently mainly in the southern part of the state, the southwestern part of the state, where there is risk, I think, of a obstetrics desert, if you will, to develop. That there's one out in that area.
Further question?
All right.
See, my concern would be, as the senator pointed out, obstetrics, gynecology, you can't get these people anymore. They're very hard to find. Those that are still working are in the high population areas. So is this, is it needed, but B, are the services available to take care of women who are with child and who need this service?
Understanding the point Senator Guida was making about relatively, the issue I think for the birthing centers is the relative is like a quarter of what the hospital is getting. And I think the legislation doesn't speak to parity. The way we interpret the legislation is that we'd be able to do something comparable, which would allow us the discretion to set a rate that would be take into account there are differences, like having to provide emergency backup, as you identified, Senator.
Well, I mean, I can understand that, but I mean, is the service available? That's my issue, because if it's not available, we're not doing anybody any favors.
Right. So for Medicaid, it's the concern here. I think why the proponents of the legislation brought it forward is that the rate is so low that can they continue to accept Medicaid patients irrespective? And I think they're getting, as I said, about a quarter of what a hospital's getting. And I don't know that they need to get what a hospital gets, but a quarter's, I can understand why they're considering not continuing to do Medicaid.
Sure. Okay. Thank you, Mr. Chair.
Senator Guida.
Thank you, Mr. Chair. Henry, can you give some estimate of what the actual cost of reimbursement rate is for these birthing centers?
The birthing centers, if I'm remembering right, and possibly you have the figure with you, but it was under $1,000 for the facility component for the birth. I think it was like $693, if I'm remembering correctly. $637 is the reimbursement for the facility component. And for the hospital today, it's between, depending on whether it's a critical access, closer to $3,000, and if it's a PPS hospital, under that. There is Senate Bill 401, which looks to raise hospital rates for birthing services by 25%. I think that's kind of where the issue lies. I think that something more than 630 something is needed to them to continue to accept Medicaid, and it's not the solution, but it's something some people choose to do, and I think we are not in a luxury position with respect to having birthing available in the state. It's really concern. It's one of my chief concerns, honestly, is maintaining the birthing network, particularly in the rural areas.
Further questions? Senator Hennessy?
No question, I just want to make a comment, that I think that the sponsors of this bill should bring it forward in next year when there's a budget, and that we don't actually have a fiscal note on this, so we don't know what we're approving right now, so that if they can get all their ducks in a row and what the actual fiscal impact would be, and what exact rate that they're looking for. Do they want to leave it up to the department, or do they want a specific rate? And is there support behind that rate? We know that the hospitals should get a higher rate because they have to have the backup services and facilities available. What do they need to have, and what would an appropriate facilities fee be?
Thank you. And Mr. Lippman?
So I think just we apologize. We're working on the fiscal note. We were caught off, if you will, guard a little bit. That 408 was coming up as fast. I thought it would come after 401, but we're working on that note if you want to have that at some point.
Okay, well, you know, our notes say that the department was asked for that back on November 22nd, and then again on December 21st, and we still don't have it. So, I mean, that's 4 months. I'm not sure how long it normally takes to come up with one. I do have one more question, though. In regard to the services that are being provided, would we be opening the door to say that any place that offer lab services or imaging services at a less cost than a hospital, that now could be justified that we raise up their rates to equal the hospitals, because we would do the same with this?
My opinion, no. As Medicaid director, there has to be access is the primary concern that would drive a change in rates. And I think for laboratory and radiology services, that the type of access issues that exist are very different than for obstetrics.
Thank you. Any further questions? Senator Rosenwald.
I wonder if the committee would consider a committee amendment to delay the effective date so that it really coincided with the next budget. And I guess what I would propose is not July 1st of 23, because I don't think we can put it out that far, but maybe June 30th of next year, so that it would be within this budget, but just at the very end, so that we would not be committing to something we have no information about during the budget. Just a thought.
Senator Gaida?
Thank you, Mr. Chairman. I'd also like to know figures of how many women are served by these birthing centers as opposed to hospitals, you know, because one of the problems we have is our declining birth rate. And when hospitals close obstetrics and gynecology, you know, birthing services, is because they don't have enough clients. Yes, the insurance is high and so forth, but if you don't have the throughput of clients to sustain the costs, that's why they close. So I'd like to know how many women are being served by them currently, and what we would expect to change by raising this rate, or lose by not raising it. Thank you.
Yeah, speaking personally, I even in changing the date, I think I would still have a problem, because the way the bill is written, it states on line 3 that we're doing this to ensure their financial sustainability. Basically, what that means is you're subsidizing an industry to keep them alive. So I have a problem with government doing that. So I would continue to vote against that. Any further discussion? Senator Gaida?
Yeah, just to be clear, okay, I'm not opposed to the concept of helping folks out, but we got no data. And that would be very, very helpful. A fiscal note, and also how many of these are there, and how many of them are in financial duress. That kind of thing too, because again, I understand the need for a service, if there really is a need, but I am also opposed to subsidizing unnecessarily. We do have some programs that help out, remote medical facilities or doctors to serve those facilities, but that's where I'm coming from. Thanks.
Thank you. Any further comments or discussion? Seeing none, thank you, Mr. Levin.
Thank you.
The motion before us is inexpedient to legislate on Senate Bill 408. Are you ready for the vote? All those in favor of that motion, say aye. Aye. Opposed, nay? And you are? Yes. Motion carries 4-2. And I'll take that one out. Senate Bill 422, establishing an adult dental benefit under the state Medicaid program.
Move on to pass.
Motion by Senator Gaida, seconded by Senator Hennessy. The bill be ought to pass.
We have a Medicaid dental director here.
We do. And we do have some questions on this. Make sure you put in for the extra mileage today.
I could use the exercise, thank you.
I think we understand that the 1.1 million in the bill is essentially coming from the Centene settlement. Is there a limit per year that someone will get on dental benefits? I mean, if I, on my dental benefit, it might be $1,000, $2,000 per year.
There's a $1,500 maximum excluding preventive services, which is kind of in the middle of what you see commercially.
Excluding preventive?
Correct.
And is that something that's written in rules? I mean, it isn't any place in the legislation here.
I think, Senator, if I could call up the dental director, Senator, Dr. Finney, please. Sure.
Good afternoon. Let me introduce myself. I'm Dr. Sarah Finney. I'm the Medicaid Dental Director. I think that Henry and I can both give you the information that you need. The specifics of the dental benefit have been laid out in the bill. So you will see that on page 2, the services that will be included. So on line 20, we start with preventive dental services. On line 23, restorative treatment. Line 24 is periodontal treatment and oral and maxillofacial surgery. And then line 26 is removable prosthodontics or removable dentures. And then you will see in the fiscal note that we've prepared, the cost estimate that was created by our actuaries have included the things that were listed in the bill and have excluded things that were not included in that treatment.
Okay, we don't seem to have a fiscal note.
Evan, can you just,
Says due to time constraints, LBA was unable to provide a fiscal note for the bill as introduced. So you may have something that we don't.
it was sent to Kevin this morning.
Senator Gaida?
Thank you, Mr. Chairman. So, Henry, you said there's a limit of $1,500 excluding the preventive stuff.
Correct.
And is that in statute, or is that, as part of Medicaid policy?
That would be part of the benefit design, and the actuarial estimate that supports the fiscal note would be based
Okay.
on that.
All right. So that will be then, should we put an amendment in here to cap it, or?
I mean, I think that if that would make the committee comfortable, that I think that's That's not something that we would object to, because that's.
That's what your plan is.
What we plan.
And I know that, personally, I think I would feel more comfortable having a specified limit in there. I mean, I understand the actuarial part of it, but we all know that that's kind of fluctuating. Is there any objection to a committee amendment setting a yearly limit?
Excluding preventive care.
Right, correct.
I lived to make you comfortable.
We appreciate you.
Any further questions? Thank you, folks.
Thank you.
Thank you.
Okay, so we talked about a committee amendment to limit the
Non-preventive.
non-preventive treatment to $1,500 a year. All those in favor of that, say aye. Aye. Opposed, nay. Ayes have it, motion carries. So we'll be back to a
OTPA?
OTPA.
So moved.
Moved by Senator Gaida, seconded by Senator Hennessy. Any further discussion? There being none, all those in favor say aye. Aye. Opposed, nay. Ayes have it, motion carries. Senator Rosenwald? I figured you would. Okay, Senate Bill 423, relative to a closed-loop referral system in the Department of Health and Human Services.
Move ought to pass.
Senator Gaida moves ought to pass, seconded by Senator Rosenwald. Any discussion? There being none, all those in favor say aye.
Aye.
Opposed, nay. Ayes have it, motion carries. And who would like that one?
I'll take it.
Okay, Senator Gaida? Senate Bill 431, relative to child support in cases with equal or approximately equal parenting schedules. 431. Is there anyone here that was on the first committee? I don't see anyone. I did have some questions on this. Maybe we'll hold off on this till after I can get
Please.
those questions answered.
Yeah.
Okay, we'll go on to Senate Bill 440, relative to approval
Second.
of offshore wind energy contracts. Motion by Senator Hennessy, seconded by Senator Reagan. 440. Okay, any discussion on the bill? There being none, all those in favor say aye.
Aye.
Opposed, nay. Ayes have it, motion carries. Senator Hennessy, you want to take that? Senator Hennessy, Senator Reagan. Okay, with that, that is all I planned on taking today. So I'll take a motion to come out of executive session. Moved by Senator Gaida, seconded by Senator Hennessy. All those in favor say aye.
Aye.
Aye, opposed nay. Ayes have it, motion carries, and we will be adjourned.